Assalamu alaikum. Today again we are here with another video of left non-functioning kidney and nephrectomy we are performing here, and I have mobilized the colon, identified the ureter, and mobilized the lower pole, and now I'm looking for the artery. You can see the vein, and you can see that there are two gonadal veins which are draining into the renal vein. So I'm trying to look for the artery. From the knowledge of the CT, we know that there is a common stump of the renal artery, and then there is an early branching. So I tried to look for the artery behind the vein, but I couldn't find it. So I decided to go on and clip the gonadal vein and then divide it so that it comes it comes away, and we can easily dissect behind it. You can see very clearly after dividing the adrenal vein, the gonadal vein. We can very easily reach the posterior aspect of the renal vein. Here we can see one of the branches. If I had to look for the common stump, then it would have been necessary to clip the second vein and divide it as well, and then we could clear the surface of the aorta and found the renal artery. So we find one smaller branch of the renal artery, and then I compressed the renal vein to see if it's distending. It was not distending, so I dissected the renal vein from behind. I'm not trying to come medial to the gonadal vein just for the risk of coming near to the renal artery. Here you can see that clamping it below the gonadal vein was distending the renal vein, but above the gonadal vein it was not distending. So I was really surprised because it was a smaller branch that we clipped, and we have another live branch of the renal artery, which is just behind the renal vein. Here you can see that one of the renal veins it started getting engorged. So this was a clear sign that we have missed the other artery. So I had to hurry up so that before the renal vein, this tributary, it is engorged so much so that I may not be able to cope with it. So I had to clearly and quickly make a window, clip it, and then cut it. You can see the ooze of blood around the renal vein after clipping it. This also shows that there is a live renal artery. So I'm cutting the renal vein really in small bits and pieces, because I know that there is another artery behind the vein, and unless and until we cut this vein, we are not able to reach it. I decided this. It is really not a recommended procedure to clip the vein first and then go for the artery. So I did it because I know that it is a non-functioning kidney. Here you can see the bigger branch of the renal artery. So because we clipped one of the branches of the renal artery, so that reduced the amount of blood in the already ischemic and fibrotic renal parenchyma. So now I quickly clip the other artery as well. You can see a clip which had a malfunction and dropped down. So I had to leave it there until I cope with the artery, and then I would plan to remove it after I'm done with the pedicle. So here you can see that both the arteries are now properly clipped, and now we are going to cut them, and then nephrectomy will be completed by dissecting the upper pole, the lateral surface, and then clipping and ligating the ureter. Thank you very much for watching.